All right, and at this time, I would like to welcome our presenters for this evening. Joining us today, we have Miss Mallory McKnight and Miss Shilea Michaelis. Both are substance abuse prevention specialists. Welcome, ladies.
Thank you. Thank you all for being here and joining us tonight for our Revive training. I am going to share my screen. Okay. So again, my name is Mallory McKnight. I am a substance abuse prevention specialist in the Student Health and Wellness Department. So today we just want to take a little bit of your time just to kind of go over Revive, which is Virginia's Opioid Overdose and Naloxone Education Program. So we're going to talk about how to respond to opioid overdoses with the use of naloxone. Our learning objectives for today, we're going to do a very brief overview of substance use disorders and addiction and what that really means. We're going to identify risk factors for overdose. When it comes to this topic, I think a lot of times we have our own ideas. We've had a long history of stigmatization when it comes to substance use and different myths that are out there. So I plan to kind of touch on a few of those myths and how you can reverse overdoses that happen, and hopefully just expand your minds when we think about substance use disorders and addiction, so it's not always thought about in a stigmatized way, because of course addiction is a disease. We're going to understand how opioid overdoses happen and understand how naloxone works in an overdose emergency. Before we get started, I do want to make note that all of our schools have Narcan. And so you might hear me use naloxone and Narcan interchangeably. They're the same thing, but one is just like the brand name for the drug. So all of our schools do have Narcan. Our nurses have Narcan in the building, as well as our school security officers and our school resource officers. And then since I want to say the 2021-22 school year, we have had monthly Revive trainings for our staff that are interested in becoming Revive trained. So at this point, we've had hundreds of staff become trained in how to administer Narcan. And in those trainings, participants have the option to request Narcan, which most of them do, to have with them in cases of overdose emergency. So I did want to make that point. So understanding substance use disorders. A lot of times when people first take a drug, they use it because a lot of times they like the way it makes them feel. When we think about young people may use for a variety of reasons. It may be because they're curious. They may see peers using it. There are family members that might use it. They just want to experiment. All of those things are, is when it comes to curiosity and experimentation, those things are developmentally, I would say, appropriate. And so sometimes because they're curious, they may think to start a substance for the first time. But the thing about it is no one ever starts initiating a substance thinking they're going to become addicted. A lot of times they're like, I can control my use, but you just don't know how that initiation of a substance may continue down the line. For some people, they can use a substance, they can use it recreationally or socially, and it never turns into an addiction. But for some others, maybe because of genetic factors, because their environment or whatever the case may be, they may go down the path of addiction. So everyone is not the same. There are different factors that can play a role in it. But it's important to understand that addiction is treatable, but to also keep in mind that addiction is a disease and we should look at it as such. It's not a matter of moral failing or they keep choosing to make these types of decisions. But after a certain point, when somebody becomes dependent or an addiction is happening, it is because it is a disease in the brain. And so we'll kind of touch on those things a little bit more. So the cycle of addiction, of course, it starts with initial use. Again, a lot of different reasons why a person may use in the first place. And one thing I didn't include before when it comes to young people, it's also important to keep in mind that young people may even start to use because of mental health things. They may have a mental health disorder, or they may be having strong feelings of sadness or anxiety, and they feel like a substance is going to help that. But it's important for them to know that in the beginning, sure, it may make you feel like you're getting away from the problem, but the problem is still going to exist. So there are, a number of people that may use because of mental health challenges. Next in the cycle of addiction is misuse. So taking higher doses, using more frequently, or just using for euphoric reasons. So even if a doctor was to prescribe you a medication, if a person starts to use it for those euphoric reasons and not for the reasons that it was prescribed, that would be considered misuse. Then moving on into tolerance. When continued use happens over a period of time, the substance can cause changes in the brain and result in tolerance. So in the beginning, it might take, using one pill in order to get that euphoric feeling. And because over time you keep using that one pill, you build a tolerance. So now you need 2 pills instead of 1, and then it can grow from there. Dependence is when a person needs a substance to be able to function properly, and not all drug dependence is considered addiction. So for example, if someone is using an opioid because they were prescribed it by a doctor, they are using it for the pain associated, the pain that's associated with that medication. So they're using it for a purpose. Once it turns into using it for euphoric reasons, that can kind of fall under the category of dependence. And then we move into addiction. So the DSM-5 explains addiction by meeting a number of criteria, such as using more of the substance than planned, being unable to stop, being unable to keep up with responsibilities, having cravings for the substance, or maybe even experiencing withdrawals when the person stops using that substance. And then reoccurrence, or what we might know as relapse, is also a part of that cycle. So opioids are a class of drugs that are chemicals. They can be natural or synthetic. There are pharmaceutical use of opioids, so things like oxycodone or hydrocodone or medications like that. Those are considered opioids, but now we're hearing a lot more about things like fentanyl. Fentanyl also has pharmaceutical use, but more of what we're hearing when it comes to overdoses has to do with illicitly manufactured fentanyl. And so that's kind of what has pushed us into this opioid crisis that we're now in. Opioids are also considered to be depressants, so they have more of a downer effect when a person uses them. And opioids are prescribed or used to treat pain. We kind of went through that. So drugs that are considered opioids: heroin, synthetic opioids like fentanyl, whether that is pharmaceutical or non-pharmaceutical, other pain relievers like oxycodone, hydrocodone, morphine, all are considered opioids. So this chart kind of just gives us a breakdown of the different types of opioids, what the trade name is, and then what the street names are. I don't want us to get caught up on the street names because, of course, names change all the time. Slang changes all the time, but it's important to understand that there are slang terms for some of these substances. And so just being familiar with the different names is helpful, but not to like rely on it, because I mean, it's a never-ending cycle when it comes to changing up street names for different substances. The risk of fentanyl contamination. So We talked a little bit about the opioid crisis that we're in right now, and that is because fentanyl is contaminating a lot of the drug supply that is on the market right now. And most of the time, it is illicitly manufactured fentanyl. So we know that fentanyl can be in things like heroin, the Xanax that's sold on the street, any type of street drug, a lot of times, especially right now, it is contaminated with fentanyl. So it's always important to just be mindful. Even when it comes to young people, they're not overwhelming numbers of cases where fentanyl is put in vapes, but there are cases like that. So it's important to even include some of that in the conversations that you have with the young people that are in your life, because nothing is really safe right now. I mean, no drug is like safe, but right now with how fentanyl is being sold on the market and contaminating different things, it's really not safe. And so it's important to communicate those types of things in the conversations that you all have. So this is through the Virginia Department of Health, and it kind of just tracks fatalities of opioid overdoses from 2007 until 2023. So as you can see, in 2020, we had a huge, don't know what's happening. In 2020, we had a huge spike in fatalities, and then that kind of just continued to rise in 2021. It declined a little bit in 2022, and I think maybe some of that has to do with naloxone and people being more familiar with what naloxone is and how to use it. And we don't have the numbers, all the numbers for 2023, but it is projected to kind of stay the same as 2022. So what is an opioid overdose? So this picture kind of gives us a good idea, if you are a visual learner, of how opioid overdoses happen. So this part right here is the opioid receptor in the brain. When opioids come into the brain, they fit perfectly on those opioid receptors. If there are too many opioids in the brain that are sitting on those receptors, it causes a person to it causes slow breathing or not breathing at all. And so this is always a good picture, a good visual for us to kind of understand how it works. And then we'll see this picture again in the next couple of slides. And if anyone is, wants to interact in the presentation today, or feel free to unmute. But do you all know of any risk factors that can make someone more likely to experience an overdose? What are some risk factors that you can think of? If you would like to put it in the chat. If not, that's okay. Ooh. Parties, yes.
Mhm.
Especially with young people. I don't know if anyone has heard of farm parties, where like everyone just kind of brings different medications and they dump it in a bowl and people just randomly take whatever is in the bowl. Brought in the home by a sibling, thank you. Having a medical condition, yes. Thank you all for putting some of those answers in the chat. Oops. So certain people are at a higher risk for opioid overdose emergencies. So prior overdoses, if someone has overdosed before, they are more likely for that to happen again. Reduced tolerance. So for people that, have built up a tolerance, and maybe they have a period where they are abstinent from the drug or whatever the case may be, and they're not using it, and then they go back thinking that they can still use at the same dosage as they did before, that person is more likely to have an overdose. Of course, mixing drugs. So mixing drugs like opioids and alcohol and Xanax and all of those different things, of course, that would increase the likelihood of an overdose, because it's just so many different substances in the system. Using alone, that is always a risk factor, because if someone is using alone and they happen to overdose, there's no one there to like call 911 or give them naloxone. So using alone is one, variations in strength or quantity or changing formulations, and then medical conditions like chronic lung disease, kidney or liver problems can be a risk factor for an overdose. If you don't mind putting in the chat again, how can you tell the difference between someone who is high and someone who is overdosed? Is there a difference? I'll check the chat. I'm not seeing anything, but I'll give it another second. Yeah, yes, overdose, non-responsive. Lethargic movement can be high. You guys are on point. Yes. The main difference between someone who is high and someone who has overdosed is responsiveness. If they are not responsive, if they are not breathing, that is considered an overdose. So those are that is the main thing. If you take away anything, it's not important to memorize all these different things that are on this chart, but just know the main thing to look out for is responsiveness from that person. So if a person is really high, their muscles can become relaxed, they have slow speech, they're nodding out, they're responsive to shouting, a sternal rub, or an earlobe pinch, they have a normal heart rate. All of those would be considered just a person being high. Overdose, the face is very pale or clammy. They have infrequent breathing, or they have just completely stopped breathing. There is something called the death rattle. So you may assume that a person is snoring or they're making like a gurgling sound, but that can also be a sign of an overdose. Unresponsive to any stimuli, slow or no heart rate and or pulse. For lighter skin people, their skin turns bluish purple, but for darker skinned people, it turns grayish or ashen. Last time in the chat, I promise. What are some myths that you have heard about ways to reverse an opioid overdose? What are some myths that you've heard that can reverse an opioid overdose? Some may be very similar to things that you hear about to help somebody kind of sober up when they have been drinking. Feel free to put it in the chat. Cold showers, food, giving them water or coffee. Yes, perfect. All great answers. All of those are definitely myths, and these are just kind of listing some things that you should not do if you're suspecting that someone has overdosed. We're not putting them in a bath because they could drown. We're not putting them in ice baths because we don't want their temperature to like dramatically decrease. You don't want to put them in, you don't want to shock them. So those are things that are not safe. You don't want to induce vomiting or give the individual something to drink because they can choke. Don't put them, oh, we already said that. Do not try and stimulate the individual in a way that can physically harm them. We're not slapping, punching, hitting, biting, anything crazy like that. We don't want to cause any long-term damage. We just want to stimulate them. And I'll talk about different ways you can try to stimulate a person to check for responsiveness. Do not inject them with any foreign substances. Don't inject them with water. Don't inject them with milk. This can cause an infection. The only way to really effectively reverse an opioid overdose is with the use of naloxone. So naloxone is an FDA-approved medication that is designed to rapidly reverse opioid overdoses. Naloxone comes in two different forms. There's an injectable form. So with the injections, there are auto injectors and then manual injectors. We're not really going to get too deep into that during this presentation, just because if you are interested in receiving naloxone, and I'll talk at the end about where you can find that at, 9 times out of 10, they're going to give you the nasal spray, not the injectable. So we don't spend much time talking about that. I have never seen the injectable naloxone because I think a lot of people have really just gravitated towards the nasal spray just because it's easier. You don't have to deal with like needles and all of that. So again, I told you guys were going to see this visual again. How naloxone works, again, you have the brain receptor, you have the opioids that enter into the brain. What naloxone does is kind of block the opioids from landing on those receptors. If they are on the receptors, it knocks them off of the receptors. And so that can cause a person to begin breathing again. And so it is very effective. But naloxone does not work for a long amount of time. So it's very important to act quickly when it comes to responding to opioid overdoses and following the proper steps in order to respond, because you really only have 30 minutes before the naloxone wears off. But we'll talk about that more in the next couple of slides. Naloxone is considered safe. There is no abuse potential of naloxone. It is impossible to overdose on it. It has no effect. So it's important to keep in mind that naloxone only works for opioid overdoses, not if a person is using cannabis or cocaine. It doesn't work for just any drug. It only works for opioids. But I always say, because we talked about the contamination of the drug supply on the market right now, you never know what has fentanyl in it. So even if a person is using, a benzodiazepine, it could be laced with fentanyl. So the naloxone would work on the fentanyl that was laced in the benzodiazepine. But if it is just the benzodiazepine, it's not going to work. But it's always better to use it and it just doesn't work than to not use it at all. Even if it expires, it is not harmful. So if you do end up getting naloxone, if it has already expired, you still want to use it. It's not going to do anything. Even for somebody that is not that is not having an opioid overdose, again, you still want to use it. If it doesn't work, it's okay. It doesn't cause any harm to the person. So this right here is just a little picture of what the Narcan nasal spray looks like. Each box has 2 doses of Narcan in it. So what a person would do would just get the Narcan, peel the sticker back, place the nasal spray in the nose, press it, and that's it. But we're gonna break it down a little bit more than that. Each of these little sprays is just 1 dose. So you would just pick a nostril, put it in, and then just administer the Narcan. How to store naloxone? I mean, just like any other medication, you don't want it to be in any extreme temperatures. And again, if it is expired, it's still okay to use. It may be a little less effective, but it would still be effective. And I'll talk about, even if you have Narcan now, or if you get it and it expires, there are places where you can go where you can replace it for free. So these are the steps for responding to a suspected opioid overdose. Checking for responsiveness, calling 911, giving rescue breaths, administering the naloxone, continue the rescue breathing, assess and respond. But we're going to go through each of these individually. So checking for responsiveness, again, you're going to try to stimulate them, but not in a harmful way. You can shout their name. You can tap them on the shoulder. You can pinch their earlobe. You can do a sternum rub. So sternum rub is like balling up your fist and taking your knuckles and rubbing it up and down the chest or the sternum. And most times, because that kind of hurts a little bit, a person would respond to that. But if a person is not responsive, they're still not breathing, you're going to proceed to the next step. And a lot of this, if anyone that's on here has taken a CPR class, a lot of this is going to sound familiar. A lot of this is going to be a review because some of these are the same steps. You're going to call 911 immediately. If there's somebody else that's there, you can ask them to call 911, but please make sure that 911 is called because, again, naloxone only works for a short period of time, anywhere from 30 to 90 minutes. If that person goes back into an overdose, which we'll talk about a little bit more, you want 911, you want, emergency responders to be on their way to take over. You want to of course, give them the exact location and report that the person is not breathing and you suspect that it is an overdose. If in a situation where you are alone, you are the only person that is responding and you have to leave to go get a phone or you have to leave to go open the door for the emergency responders, you want to make sure that you put them in this recovery position. So it looks like this. You're turning them over to the left side. The leg is going over the other leg. You want to kind of put them in like a sideways sleeping type of position. This helps with preventing any type of choking or any further I don't want to say damage, but anything further. So this definitely helps. Anytime you leave a person that you suspect has overdosed, you want to leave them in this position. Then you're going to give 2 rescue breaths. We do these trainings every month, and a few times it has come up because of fentanyl. We know how potent it can be. We have heard stories where a person just comes in contact with it just by touching it, and that person ends up overdosing. If you are not comfortable doing the rescue breaths, that is okay. We encourage it, but only, again, if you feel comfortable. You're going to place the person on their back, tilt their chin up, again, just like CPR, pinch their nose, and then you're going to give those 2 rescue breaths. Oh, sorry, I see there's something in the chat. Oh, never mind. So yeah, again, if you're comfortable with it, when you do go to get Narcan, maybe from your local CSB, and we'll talk about those different locations that will give you free Narcan. Going to those places that will, so like if you go to CSB, the CSB may give you a mouth guard, and so that can also be helpful. They give away like little baggies that include like the instructions for Narcan administration. They give you the Narcan and they give you gloves, a mouth shield. I will say that they run out of those fairly quick. So they don't always have that, but they always can get you Narcan. And I think if you ask, yes, sorry, CSB is the Community Services Board in Prince William County. But they will give you what you need. But again, only if you're comfortable giving those rescue breaths. Then you're going to administer the Narcan. Once you administer it, within 30 to 45 seconds, you should see something. If that person has not responded in that amount of time, you want to move forward with the next step. This says up to 3 minutes, but 3 minutes is a little bit of a long time. If they're not responding within like a minute, you want to move on to the next step. So you're going to assess and respond. Most people will recover after a single dose of naloxone is administered, but it's important to understand the drug supply on the market right now. There are large amounts of fentanyl that is laced a lot of times into other drugs. And so I've heard stories of like 5 doses of Narcan having to be administered to a person because it's just that much opioid in the system. And so they may require more than 1 dose of Narcan. So there are 2 cases in which you may need to administer a second dose. Situation A, the person has not responded to that initial dose within 3 minutes, but again, maybe within a minute. If they have not responded, you want to give them a second dose. So like I said, those boxes of naloxone, they have 2 doses in them. So you want to give them that second dose. If there is still no response, Oh, well, if a person remains unresponsive after that second dose is administered, continue rescue breathing or doing CPR until emergency response services arrives. And because with emergency personnel, they always have Narcan available. So if you only have that one box with those 2 doses, when they get there, they can administer more if needed. Situation B, the individual suffers a relapse. So let's say they were responsive within those 30, 45 seconds, but because of what they took, it may have just so many opioids in the brain that a person can fall back into an overdose. So even if you give them the Narcan, you don't just want to walk off because we don't know if that person could go back into that overdose. So you want to make sure that you or someone else stays there with that person until emergency responders are there. Or, again, 30 minutes to 90 minutes is how long the naloxone kind of works. So if it's past that time, that person may go back into an overdose and they may require a second dose. Aftercare of a recovered person. People wake up from overdoses in a lot of different ways. They are rarely violent or combative. Most of the time, they're not getting up and wanting to fight you. I mean, I think I've heard of kind of situations, but they're rare where the person is just angry. A lot of times they're just confused on what just happened. So you want to explain to them what happened and emphasize the importance of waiting for emergency medical services. But of course, you cannot make someone stay there if they don't want to stay. So you do your part by encouraging them, like, hey, I've called 911, someone is on the way. You might want to be assessed. But if they don't want to, we're not going to try to force them. If the person is dependent on opioids, they will experience acute withdrawal symptoms. Like disorientation, nausea, vomiting, sweating, shaking. So those are some things to kind of look out for after you have administered Narcan and that person is now alert. So these are just some frequently asked questions. Is naloxone free? Yes. Well, yes, depending on where you get it from. If you get it from a pharmacy, I think the nasal spray is around $40, but there are different organizations or agencies that do give out Narcan for free. So the Community Services Board in Prince William County, they will give it to you for free. You would just reach out to them and they will actually mail it to your home. So you don't have to go there to pick it up. They can mail it to you. Also, the health department, they give it out for free. Even I think I don't know where they are, but there are a few naloxone vending machines that they have now. And you can just pay right there. I think it's about $40 and you can obtain naloxone in that way. Healthcare providers, I know my father-in-law, when he went to the hospital for a surgery, they prescribed him an opioid and then they also gave him Narcan just in case. So healthcare providers may also provide you with that. You do not need a prescription for naloxone. You can just walk into a pharmacy and obtain it. And that's actually all that I have. These are just some training forms to go through the Department of Behavioral Health and Developmental Services. You can fill out any of uh, these surveys if you would like to, but it's not required. If you would like a certificate for attending today's training, there's also a link for that right here where you can just request it and they'll mail it, not mail it, but they'll give it to you through your email. And here's just my contact information. If you have any questions, if you want to follow up about anything, I'm always happy to help myself or Shalia. And Shalia, I didn't even put your information up here. But if you even call my number and you want to talk to Shalia, I will transfer you. So it's no problem. I'm going to put it back on this slide just in case anyone wants to take pictures of this and request a certificate or anything that is available to you. But I will open it up for questions if anyone has any questions that I can answer. And then if not, that is all I have for this evening.
Hey, one of the things that you mentioned is when you said when someone starts using like a drug or something like that, the difference when it becomes more of a habit, I guess it's when they use it in for euphoric. Can
Mhm.
you elaborate a little bit on that?
Yes. So let's say, so the same example, like if a person has an injury and they are actually prescribed an opioid, if the person is using it the way that it's prescribed, that is not really considered dependence or an addiction, because they're using it in the way that it's described. I mean, that is prescribed. If a person starts to use it to get a high from it, those are signs that we kind of look at to say, okay, well, maybe that person has become dependent on it because you're not using it for the pharmaceutical reason that it was prescribed. The person will be using it to try to get a high from it. So that's definitely considered misuse or dependence or addiction, depending on where they are in that cycle. I hope that makes sense.
Yes. And then I have another one. If
Mhm.
a family member, someone suspects that maybe one of our family members is using, what would you recommend that we do? Like, what could be a first step?
Um, Always, if you're looking, of course, the conversation is always the first step. And when that person comes to you, I would always encourage to just be very open because a lot of times it's hard for people to even acknowledge like, oh, I think I do have issues with dependence to a substance. So I would definitely say if you have someone that a loved one that has come to you with that issue, please be open. Please don't try not to be like judgmental, like, oh, you need help. Oh, you're an addict, or use any of that like stigmatizing language. That would be a first step. Resources, I always recommend Prince William County Community Services Board for any type of like mental health or substance use support. They have a long list of resources, and even if it is something that they can't necessarily address, they are well connected and they can kind of point you in the right direction because there are a number of community agencies that can support someone, whether that be through, some type of outpatient therapy, whether that be medication assisted treatment, whatever the case may be. Or it might just be, a person may feel like they can benefit from like a group counseling type of setting, like AA or NA or something like that. But the CSB is always a good starting point after that conversation is had if a person is looking for some community resources.
Thank you.
Mhm.
And there was a question in the chat about the presentation today. Someone came in a little late. And so I will be doing a follow-up email to all who registered. And so this PowerPoint presentation, as well as the video recording, will be provided to all so that you have it to view on your own time. I don't see any other questions in the chat at this time, so I would like to thank Mallory and Shailia for joining
Can
us
I add
today.
one
This
more
is
thing?
great information.
Do you mind if I just add one more thing, just as
No, go
kind of
ahead.
like a
Go ahead,
last
please.
thing?
Mhm.
I thought about it after you started asking the questions. Um, just because I mean, I'm just assuming that most of the people on this call have young people in their lives. Maybe it's their child, maybe it's just another family member. Um, I would encourage to have the conversation, whether you think that that young person is already struggling with this, or you just, you don't have any thoughts that they are. I would always encourage that conversation with young people because you just don't want to assume. You want to be the person that is in their life that gives them factual information, because if you're not giving them information, please believe they're going to get that information from somewhere else that's probably not the most credible source. It could be a friend or it can be from like social media, and you just don't want them to have the wrong information. So if there's anything you could leave with tonight, it would be to have the conversation with the young people in your lives. And that doesn't have to be like, oh, well, let me sit down and talk to you about all these drugs. No, the best way to go about it is to just even see what they know. Like have just a very casual conversation, like, oh, have you heard of such and such? Or tell me what you know. Is this something that you all have talked about in school? Because this information is shared, I will say, in our elementary schools. Our school counselors handle that topic. They do prevention lessons from kindergarten to fifth grade. And then starting in sixth grade, going up until 10th grade, the health and PE teachers cover this topic with students. So it's always good, even though we're doing our part to teach them the information, for you all as family members to also give them that information. So just so it's reinforced and they're hearing it more than the one time that they get it in health and PE or a counseling lesson or anything like that. Because I think right now the issue is just too big. The risks are just too big. And to know what young people have access to, whether it be, pills or vaping or marijuana, I would just encourage that you have that conversation.
Well, thanks again to Mallory and Shilea. We have posted the survey for today's session in the chat. Please take just a couple of minutes to fill that out. Let us know how we're doing. And then also if you want to see any future programming. So just give us an idea what type of programming you would like to see in the future. So thanks again, everyone, and I hope you have a wonderful evening. Thank you.
Thank you.